Hernia causes, symptoms, and treatment. Have you ever felt a strange bulge in your abdomen or groin? Maybe you've experienced pain when lifting something heavy? If so, you might be dealing with a hernia. But don't worry. Today, we'll break everything down in simple terms. What is a hernia? A hernia happens when an organ or tissue pushes through a weak spot in the surrounding muscle or tissue. It usually appears as a lump that can sometimes be pushed back in, but not always. Hernias can affect people of all ages, from newborns to older adults. Common types of hernias. Inguinal hernia, found in the groin, more common in men. This is the most common type of hernia, accounting for around 75% of all cases. It occurs when a part of the intestine pushes through the abdominal wall. Femoral hernia, also in the groin, but more common in women. Though less common, it can be dangerous if not treated. Umbilical hernia, occurs around the belly button. This type often affects infants and can sometimes resolve on its own. Hiatal hernia, happens when the stomach pushes into the chest area through the diaphragm. This can lead to acid reflux and GERD, gastroesophageal reflux disease. Incisional hernia, forms through a scar from past surgery. These are more common in individuals who have undergone abdominal surgeries. Epigastric hernia, occurs in the upper part of the abdomen and involves fatty tissue pushing through the abdominal muscles. Spigelian hernia, a rare type of hernia that occurs along the side of the abdominal muscles. Obturator hernia, a rare pelvic hernia that mostly affects elderly women and is difficult to diagnose. What causes a hernia? Hernias are caused by muscle weakness and strain. Some common triggers include lifting heavy objects improperly, persistent coughing or sneezing, obesity pregnancy, straining during bowel movements, previous surgery weakening the muscle wall, aging, which naturally weakens muscles, chronic lung disease, poor nutrition, which can weaken muscle tissue, genetic predisposition symptoms of a hernia, a visible lump or bulge, pain or discomfort, especially when bending or lifting, a heavy or dragging sensation, heartburn or acid reflux in hiatal hernias, weakness or pressure in the affected area, nausea and vomiting in severe cases, difficulty swallowing in hiatal hernias. When should you see a doctor? Some hernias don't cause pain, but that doesn't mean they should be ignored. Seek medical attention if the bulge becomes painful. You experience nausea or vomiting. The hernia cannot be pushed back in. You notice sudden swelling or color changes. You have trouble eating or swallowing. How is a hernia diagnosed? A doctor can usually diagnose a hernia through a physical exam, an ultrasound or CT scan for deeper hernias, endoscopy for hiatal hernias, MRI scans in complicated cases, barium X-ray for digestive tract involvement. Treatment options. Hernias don't go away on their own. Treatment options include watchful waiting. Small, painless hernias might not need immediate surgery but should be monitored. Lifestyle changes. Losing weight, avoiding heavy lifting, and eating fiber-rich foods can help. Medications. Proton pump inhibitors, PPIs, for acid reflux in hiatal hernias. Surgery. The only way to permanently fix a hernia. The two main types are open surgery. A larger incision is made to push the hernia back in and reinforce the muscle with stitches or mesh. Laparoscopic surgery. A minimally invasive procedure using small incisions, a camera, and mesh reinforcement. Robotic surgery. A more advanced form of laparoscopic surgery with improved precision. Hernia surgery recovery process. First few days, pain and swelling are common. Rest is essential. Week 1 to 2. Gradual movement is encouraged, but no heavy lifting. Week 3 to 6. Light exercise can be resumed. Beyond 6 weeks. Full recovery is expected for most people, but some may take longer. Complications if left untreated. Ignoring a hernia can lead to serious complications such as strangulation. The blood supply to the herniated organ gets cut off, which is life-threatening. Obstruction. The intestine becomes blocked, leading to severe pain and nausea. Chronic pain. A hernia that isn't repaired can cause ongoing discomfort. How to prevent a hernia. While not all hernias are preventable, you can reduce your risk by maintaining a healthy weight, lifting objects properly, strengthening core muscles, eating a high-fiber diet to prevent constipation, avoiding heavy lifting if you're at risk, wearing supportive belts if necessary. A hernia can be uncomfortable and even dangerous if left untreated. If you suspect you have one, don't ignore it. Talk to a doctor and explore your options. Stay informed, stay healthy, and take care of your body.